There's a skin side effect from your blood pressure pill, Amlodipine, that you probably haven't heard about. According to NIH data, fewer than 1% of people taking Amlodipine develop skin reactions. This means that for every 10,000 people on the medication, 100 might be dealing with strange marks on their skin, often without realizing the connection. Most people expect side effects like ankle swelling or dizziness, but these skin changes are rarely talked about. They can range from simple rashes to rare, serious allergic reactions. Some case reports describe reddish-brown patches called Schamberg's disease that improve after stopping the drug. There's even a reported case of angioedema, a rare but dangerous allergic reaction that can block the airway. In this video, we'll go through 9 skin-related side effects of amlodipine, what they look like, why they happen, who's at risk, and when you need to take them seriously. This video is for educational purposes only and not medical advice. Always check with your doctor before making changes to your medication. Most people taking amlodipine notice the usual side effects, like swollen ankles, occasional flushing, or some gum changes. These are expected and talked about often. But the skin effects? They're so rare, affecting less than 1% of patients according to NIH data, that they're rarely mentioned. Yet, they can be serious and surprising. These skin reactions range from simple rashes to more dangerous conditions. For example, there's Schamberg's disease, reddish-brown patches caused by fragile blood vessels. While rare, there are also reports of dangerous angioedema, a rapid swelling that can block the airway and requires immediate emergency care. Because these side effects are uncommon, many people don't realize their skin changes might be linked to their medication. In the next parts, we'll explore 9 different skin-related side effects of amlodipine. What they look like, why they happen, who's at risk, and when to take action. The first side effect to watch for is a rash. It usually appears within 2 to 4 weeks after starting amlodipine, even at the common 5 mg dose. You might notice red patches or small raised bumps on your arms, chest, or legs, sometimes flat, sometimes bumpy. Doctors call this a maculopapular rash. According to NIH and PubMed data, about 0.5 to 1% of users experience this rash. It happens when the immune system mistakes the drug for a threat, triggering inflammation in the skin. Rarely, the rash can develop into hives, or in less than 0.1% of cases, angioedema, a much deeper swelling that requires urgent medical care. Most rashes are mild and improve after stopping the medication. Antihistamines or topical creams can help relieve itching. Sometimes your doctor may do patch testing to confirm if amlodipine is the cause. People with a history of drug allergies, sensitive skin, or those on multiple medications are at higher risk. If you notice red spots or rashes after starting amlodipine, take a photo, note when it began, and contact your doctor promptly. Key point: while rare, affecting under 1% of users, rashes should always be taken seriously and checked by a healthcare professional. The second skin side effect linked to amlodipine is hives, medically known as urticaria. These are raised, red, itchy bumps that can pop up anywhere on your body. You might see them on your arms one day, only for them to fade overnight, and then suddenly appear somewhere else. This moving pattern is a classic sign of hives. According to NIH and Mayo Clinic data, hives affect less than 1% of people taking amlodipine. It happens when certain cells in your skin, called mast cells, release histamine, a chemical that causes small blood vessels to leak fluid, resulting in those itchy bumps. For most, hives are mild and go away after stopping the medication. Antihistamines usually help, and cold compresses can ease the itch. But in very rare cases, less than 0.1%, hives can lead to a serious condition called angioedema. This is deeper swelling that can affect your lips, tongue, or throat and make it hard to breathe. If this happens, it's an emergency, and you need immediate medical attention. If you ever notice sudden itchy welts after starting a new medicine, don't ignore them. Take a photo, note when they appeared, and contact your doctor right away. The takeaway: most hives cases are harmless and short-lived, but spotting the early warning signs could be life-saving. The third skin side effect is called Lichenoid reactions. These develop slowly over weeks or months and often surprise both patients and doctors. They look very much like a chronic skin condition called lichen planus, presenting as flat, purple bumps on the wrists, ankles, or even inside the mouth. These reactions are rare, with fewer than a dozen cases reported worldwide. They occur because amlodipine alters certain proteins in the skin, triggering an immune response that causes inflammation. The lesions typically fade after stopping the medication, and using topical corticosteroids can help speed up healing. Doctors rely on carefully tracking when symptoms started relative to medication use to diagnose this reaction. It's more common in older adults or those with autoimmune conditions. If you notice purple bumps developing months after starting amlodipine, be sure to tell your doctor exactly when they appeared. The key takeaway: although rare, recognizing lichenoid reactions early prevents misdiagnosis and unnecessary worry. The fourth skin side effect is pigmentation changes, which often catch people by surprise. Amlodipine can sometimes cause dark or reddish patches on the skin, most commonly on the lower legs, ankles, or feet. Doctors describe this condition as Schomburg-like pigmentation. This side effect is extremely rare, with only a few case reports documented worldwide, including in NIH studies. It typically develops after long-term use or higher doses of the drug, around 10 milligrams daily. The exact mechanism isn't fully understood, but the leading theory is that amlodipine weakens tiny capillaries under the skin. When these small blood vessels become fragile, red blood cells leak out. As they break down, iron pigments deposit in the skin, creating those brown or copper-colored patches. In some cases, these pigmentation changes lasted even after stopping amlodipine, though they may fade slowly over months. Importantly, this type of pigmentation is not harmful. It doesn't affect the heart, kidneys, or liver. However, when the patches appear on visible areas, they may impact a person's confidence and quality of life. If you notice new discoloration on your legs or feet while taking amlodipine, don't ignore it. Take a picture, note when it first appeared, and inform your doctor. Sometimes switching to another medication can stop the pigmentation from progressing. The good news is that some published cases, including reports in PubMed Central, show the discoloration gradually lightening once the drug is discontinued. This means your skin can recover, but it takes time and patience. In short, pigmentation changes with amlodipine are rare and harmless, but staying observant helps ensure your treatment remains both effective and comfortable. The fifth skin side effect is eczema-like eruptions, which can be tricky even for doctors to recognize. These eruptions look very much like eczema: dry, red, itchy skin that may flake or crack. But here's the key difference. This usually happens in adults who have never had eczema before, and it starts only after beginning amlodipine. Reports from NIH and Mayo Clinic show these reactions are extremely rare, affecting far less than 1% of patients. When they do appear, timing is a big clue, often weeks or months into treatment. The exact cause isn't fully clear, but it's thought to be a mild immune reaction. Amlodipine may slightly alter the skin's immune signals, causing inflammation similar to atopic dermatitis. It's generally not a true allergy, but more of a sensitive or irritated response from long-term use. Symptoms can be uncomfortable, including itching, dryness, and sometimes visible scaling on the arms, chest, or legs. Treatment usually follows eczema protocols: topical corticosteroids to reduce inflammation, moisturizers to repair the skin barrier, and antihistamines for itch relief. Typically, the condition improves within several weeks after stopping or changing the medication. If you notice new dry or itchy patches that didn't exist before starting amlodipine, it's important to tell your doctor. They can help determine whether it's true eczema or a drug-related reaction. The good news: in nearly all reported cases, the skin returned to normal once amlodipine was discontinued. So while rare, the side effect is reversible. Coming up next are reactions that are far less common, but much more serious. The sick skin. Side effect: severe reactions. This next group is the rarest of all, but also the most serious. These are what doctors call severe cutaneous adverse reactions, or SARS for short. They include Stevens-Johnson syndrome, toxic epidermal necrolysis, DRESS syndrome, and angioedema. According to data from the NIH and the American Heart Association, these events occur in fewer than 0.1% of amlodipine users. That's less than 1 in 1,000, but they require immediate medical attention when they happen. Stevens-Johnson syndrome and toxic epidermal necrolysis usually start with flu-like symptoms: fever, sore throat, and fatigue, followed by painful blisters or peeling skin. The difference is in severity. In 10, the damage spreads more widely, covering large areas of the body. Both are medical emergencies that need hospitalization and supportive care. DRESS syndrome, which stands for drug reaction with eosinophilia and systemic symptoms, is another rare but dangerous reaction. It causes a widespread rash, fever, swollen lymph nodes, and inflammation of internal organs, such as the liver or kidneys. Although rare, it carries a significant risk of complications if not recognized early. And then there's angioedema, a rapid, deeper swelling that can affect the lips, tongue, or throat. Unlike hives that stay on the surface, this swelling happens under the skin and can block the airway. It's rare, but life-threatening. There's even a documented case published in PubMed Central describing amlodipine-induced angioedema, where symptoms resolved after discontinuation of the drug. These reactions are thought to result from a hypersensitive immune response, where the body overreacts to the medication and attacks its own tissues. It's not predictable, and it doesn't depend on dose or duration. So, if someone taking amlodipine develops a rash with blisters, fever, or sudden swelling of the face or throat, this is not something to wait on. Call emergency services or go to the hospital immediately. Fortunately, these reactions remain exceedingly. The seventh skin side effect involves a few rare patterns that don't fit into the common categories but have been documented in medical literature. These include delayed hypersensitivity and a rare condition called linear IgA dermatosis. Delayed hypersensitivity presents as a rash that appears weeks or even months after starting amlodipine. The rash usually fades gradually once the medication is stopped. Linear IgA dermatosis is even rarer. It causes tiny blisters forming in a straight line across the skin, resulting from antibodies collecting beneath the skin surface. While this condition is more often linked to antibiotics, A few case reports describe it in patients using calcium channel blockers like amlodipine. These reactions are unpredictable and not related to the dose taken. Awareness of these rare patterns helps doctors correctly diagnose and manage the symptoms. If a rash develops long after you start your medication, it's important to share this timeline with your doctor. The key takeaway. Although exceptionally uncommon, recognizing these unusual skin reactions early ensures safer and smoother treatment. The eighth skin side effect is alopecia, or hair thinning and loss, something patients rarely expect. Though uncommon, case reports from NIH and PubMed Central have linked long-term amlodipine use to gradual hair shedding that develops over several months rather than abruptly. The exact mechanism isn't fully understood. Experts suggest it may relate to reduced blood flow to hair follicles or mild immune changes in the scalp. Amlodipine, as a calcium channel blocker, can sometimes alter blood vessel function and scalp environment, which might contribute to hair loss. In every documented case, hair growth returned after stopping or switching the medication. While alopecia from amlodipine is not harmful to overall health, it can impact self-confidence. If you notice thinning hair after being on amlodipine for a while, mention it to your doctor at your next appointment. There may be safer alternatives, such as losartan or other blood pressure medications, better suited to your health profile. In summary, hair loss linked to amlodipine is rare and reversible, but early recognition makes it easier to manage a medication change if needed. The last skin side effect to watch for is purpuric eruptions. These are small purple or reddish spots that look like bruises. They occur when tiny, fragile capillaries under the skin break and leak small amounts of blood beneath the surface. These spots most often appear on the lower legs and ankles. According to published reports in PubMed Central and other medical sources, this reaction is uncommon but reversible once amlodipine is stopped. Purpuric eruptions tend to affect older adults more frequently, especially those taking multiple medications that impact circulation, such as diuretics or blood thinners. A key detail is that these spots typically don't itch or hurt. They may slowly fade over several weeks. Even though this reaction is harmless, it's important to document these spots by taking a photo and sharing it with your doctor. This helps rule out other serious causes and ensures proper monitoring. In summary, purpuric spots linked to amlodipine are rare and not dangerous. Early recognition helps make sure no more serious issues are missed. Now that we've covered all 9 skin side effects of amlodipine, here's what really matters to you. If you notice any new rash, discoloration, or swelling after starting amlodipine, pay close attention to when it began and where it appears. Early reactions like redness or hives usually show up within weeks, while later ones, such as pigmentation changes or hair thinning, can take months to develop. Most skin changes are mild and tend to fade once the medication is stopped. Simple treatments like antihistamines, moisturizers, or topical creams can usually help ease symptoms. However, if you see blisters, develop a fever, or experience swelling of the lips or throat, these are medical emergencies. Seek immediate care. For persistent or recurrent skin reactions, your doctor may suggest switching to another blood pressure medication, such as losartan or metoprolol. Here's the reassuring fact. Fewer than 1% of amlodipine users experience any noticeable skin reactions, and serious cases are exceedingly rare. Still, staying alert about changes helps make your treatment safer and more comfortable. If you found this information helpful, consider subscribing to MedDose Explained for clear, evidence-based insights about blood pressure medications and other common treatments. And I'd love to hear from you. Have you or someone you know ever experienced skin changes while taking amlodipine? Share your story in the comments below. Your experience could truly make a difference for someone else.